You're seeing a patient, the eyes are red, they're itchy, they're weeping. Red, itchy, weeping. Sounds like a slam dunk diagnosis, conjunctivitis. But wait, is it viral or allergic conjunctivitis? Both are very common but are often misdiagnosed. And in this video, I'm going to break it down so by the end of the video, it's going to be as clear as an ophthalmology pun. But first, what is conjunctivitis? Conjunctivitis is inflammation of the conjunctiva, and it's a common cause of a red eye. The conjunctiva is a clear mucous membrane that lines the front part of the white sclera called the bulbar conjunctiva, in the back of the eyelids called the palpebral conjunctiva. Conjunctivitis begins with an insult, infectious or non-infectious, that triggers an inflammatory response which includes vasodilation, increasing blood flow, leading to redness of the eye and enlarged conjunctival blood vessels. Also, increased vascular permeability, allowing immune cells and proteins access to the conjunctival tissue where they act to clear the pathogen or respond to the allergen. This can lead to swelling of the conjunctiva called chemosis and eyelid edema, and it can also cause watery discharge. It can be characterized by the presence of follicles or papillae that form on the backside of the eyelids. Follicles are small, dome-shaped collections of lymphocytes. There's no central vascular core, a difference from papillae, and they're often found inferiorly, and they're common in viral conjunctivitis. Papillae tend to be larger, cobblestone-shaped bumps that do have a visible central vascular core, and they're often found superiorly. They're a sign of inflammation, and they're often associated with allergic conjunctivitis. A way to remember that is papillae has two A's and no V's, so think allergy, although papillae can occur in other types of conjunctivitis. Let's dive deeper into viral conjunctivitis. So this is what many people call pink eye. It's an infectious conjunctivitis caused by a virus, most commonly adenovirus. There are other viruses that can cause conjunctivitis, but we're going to focus on adenoviral conjunctivitis. Adenovirus targets the eyes, leading to conjunctivitis, the respiratory tract, leading to the common cold, pneumonia, and other respiratory conditions, and the GI tract, leading to gastroenteritis, primarily in children. It's the most common conjunctivitis in adults, and it can spread by direct contact, airborne through respiratory droplets, or through reservoirs like swimming pools. Patients often report being around someone with similar symptoms or currently or recently having upper respiratory infection symptoms. The incubation period is reported to be about 5 to 12 days, and viral conjunctivitis is highly contagious. The length of time that someone is contagious is about 10 to 14 days from symptom onset, although there may be some variability. There are three types of adenoviral conjunctivitis. Follicular conjunctivitis is the most common type and is characterized by follicles on the conjunctiva. Epidemic keratoconjunctivitis, or EKC, is a more severe form, and it can affect the cornea, leading to subepithelial infiltrates that look like small, faint white circular dots on the cornea that do not positively stain with the orange sodium fluorescein eye stain, so they don't highlight neon green, which is different than a corneal infiltrate caused by bacteria. Pharyngoconjunctival fever is associated with pharyngitis, fever, and bilateral conjunctivitis, and it often affects kids. The onset is gradual, with symptoms occurring over days, a key difference from allergic conjunctivitis, which is sudden, with symptoms often occurring within minutes to a few hours. And the laterality can be unilateral or bilateral. But here's a key point. It classically starts in one eye and spreads to the other, which further supports how contagious this can be. Common symptoms include eye redness, itchiness, irritation, foreign body sensation, tearing to the point where the eye can just be weeping, blurry vision, photophobia, and mattering upon awakening. On exam, there's conjunctival injection leading to the red eye appearance. There can be conjunctival edema or chemosis, but that's not always present. Conjunctival follicles, as mentioned earlier, punctate keratitis on the cornea, eyelid edema and erythema. There can sometimes be small, dried matter along the lashes, especially in the morning. A key differentiator is the presence of a painful preauricular lymph node. It's not always present, but when it is, it's like being handed a map when you're lost. It's a good clue that what you're seeing is potentially viral conjunctivitis. So this painful preauricular lymph node can occur in all three types of viral conjunctivitis, but it's more common in pharyngoconjunctival fever and EKC. This next point I really want to drive home. The severity of the exam can range from mild to severe. In some cases that I've seen have looked really bad, even to the point where it could look just like post-septal orbital cellulitis. The viral conjunctivitis, sometimes I feel like it doesn't get enough credit to where somebody just has viral conjunctivitis. Well, actually, patients can be quite symptomatic and can have significant eyelid edema, significant conjunctival injection, and it can just look really bad. Another thing that's going to help is the lack of mucopurulent discharge. And I'm talking about that thick mucopurulent discharge that is common in bacterial conjunctivitis or even post-septal orbital cellulitis, especially due to bacteria. A couple exam findings that can occur in epidemic keratoconjunctivitis, which I'll refer to as EKC in the rest of this video, is there may be a conjunctival membrane or pseudomembrane, and the difference is a true membrane bleeds upon removal, but either of which can be a clue of more severe infection. The membranes can cause discomfort, and it's important to remove the membranes to avoid scarring. There could also be subepithelial infiltrates on the anterior aspect of the cornea. So as mentioned earlier, these are small, faint, whiter spots that can cause photophobia and blurry vision. Both may need a topical steroid, which is recommended to be started by an ophthalmologist, and caution should be used because a steroid can prolong viral shedding. All right, let's talk about management. Like a common cold, viral conjunctivitis is self-limited and generally resolves on its own. So basically, you have to let the body clear it out, but there are measures that can help with symptom management, and it's important to minimize the spread as best as possible because of how contagious it can be. It's also important to counsel the patient that it can take time. It can take weeks to resolve, anywhere from 1 to 4 weeks. And it often gets worse before it gets better. I'm going to say that again. It often gets worse before it gets better. That's high yield in connection to viral conjunctivitis. Patients are highly contagious, so it's important to avoid spreading following these measures until symptoms have completely resolved. So frequent hand washing, avoid sharing items like towels, makeup, etc. Avoid contact with eyes, telling patients leave your eyes alone. Try your best not to rub, avoid shaking hands, avoid swimming, etc. Symptom management is generally with supportive care. No prescriptions are needed. The exception is a patient with EKC who has subepithelial infiltrates or a conjunctival membrane or pseudomembrane. This may require a topical steroid prescribed by an ophthalmologist. Otherwise, management is symptom control. Frequent cold compresses can help with irritation and swelling. Frequent lubricating drops, like over-the-counter preservative-free artificial tear eye drops, can help with irritation. So for example, 4 to 6 times a day as needed, and the patients can use as much as they want, especially if they are preservative free. And here's a tip. Tell the patient to put the lubricating drop in the refrigerator. That'll chill the eye drops and will feel really nice on an irritated eye, and the patient's going to love you. Over-the-counter allergy eye drops can be used as needed for itchiness, and because this is due to a virus, antibiotic eye drops are not indicated. Additionally, no contact lens wear, so it's important to ask the patients to wear contacts. If so, take it out. Don't resume until the symptoms have completely resolved or until the patient's cleared by an eye doctor. Avoid eye rubbing. In general, viral conjunctivitis is contagious as long as the eye is still tearing and producing discharge, so it's recommended to stay home from work or school until these symptoms have resolved. A local eye doctor can help provide specific guidance depending on the specific presentation. And also, something to consider is isolating the patient in your clinic or the ED to help minimize the spread. An interesting treatment option is 5% povidone iodine or betadine. So betadine is often used in eye and eyelid surgeries as an antiseptic. It's been reported that instilling a drop of 5% povidone iodine onto the affected eye with viral conjunctivitis has the potential to reduce viral load and possibly decrease symptoms. But it is important to note that it is not an FDA-approved treatment for viral conjunctivitis. Betadine does lead to eye stinging, so what can help is numbing the eye first with a numbing eye drop like proparacaine or tetracaine, then instilling the povidone iodine, and afterwards rinsing the betadine off the eye. An example application method is numb the eye, place a numbing drop of, let's say, proparacaine, then place a drop or two of betadine, have the patient close their eyes, and then rinse the eye out with balanced salt solution or sterile normal saline. A quick mention about the concentration. It is important to use 5% and not 10% because 10% can damage the cornea. Although viral conjunctivitis is generally self-limited, there can be complications as listed on the screen, so it's important to have a patient follow up with an eye doctor. Let's move on to allergic conjunctivitis. So this is a type of non-infectious conjunctivitis that occurs in response to an allergen. It can be seasonal, like in response to an airborne allergen like pollen, or year-round, like dust mites or perfume. Seasonal and perennial allergic conjunctivitis is a type 1 hypersensitivity reaction mediated by IgE antibodies. Upon re-exposure to an allergen, IgE antibodies bound to conjunctival mast cells triggers mast cell degranulation, releasing inflammatory mediators like histamine in the early phase. This leads to itching, vasodilation, and increased vascular permeability, causing redness, swelling, and tearing. In the late phase, eosinophils and other inflammatory cells are recruited, contributing to prolonged inflammation. Other types include atopic keratoconjunctivitis, or AKC. It's chronic and often associated with atopic dermatitis like eczema, which can involve the eyelids, and there's often a history of other atopic conditions like asthma. Vernal keratoconjunctivitis, or VKC. This is chronic, seasonal, typically in hot, dry climates, and often occurs in young males. Giant papillary conjunctivitis is where there's giant papillae on the palpebral conjunctiva, particularly the upper lid. It results from mechanical irritation, like from a contact lens that's poorly fit or worn too long, an exposed suture, or a prosthetic eye. It's not a true allergy, but the presentation can mimic an allergy. There's also contact allergy, which generally occurs from direct contact, like makeup or contact lens solution. The onset is acute. In laterality, it's usually bilateral. Remember, in viral conjunctivitis, it could be unilateral or bilateral, but classically starts in one eye and moves to the other eye. But in allergic conjunctivitis, both eyes are usually affected at the same time. For symptoms, the hallmark symptom is severe itching, often worse than in viral conjunctivitis. Also, redness, tearing, irritation, foreign body sensation, pain, eyelid swelling, blurry vision, which is usually mild unless it's a severe case. And there may be photophobia, like in vernal keratoconjunctivitis. The exam varies depending on the type, but as an overview, there's commonly conjunctival papillae that can range in size from small to giant, conjunctival injection leading to eye redness, watery discharge, and there may be mild, stringy mucoid discharge, but it's usually not the thick discharge like in bacterial conjunctivitis. There can be thickening of the tarsal conjunctiva, and there may be chemosis, which can be more prominent than in viral conjunctivitis. Remember, chemosis is conjunctival edema. Eyelid edema, eyelid hyperpigmentation. There may be an allergic shiner, which results from congestion from nasal allergies that leads to blood pooling under the eyes, leading to discoloration and a bruise-like appearance under the eyes. Eyelid dermatitis, especially in atopic keratoconjunctivitis. And an important thing I wanted to point out is that there is no painful preauricular lymph node, and that's a key difference from viral conjunctivitis. The symptoms generally resolve faster in allergic conjunctivitis, often within hours of removing exposure to the allergen, but in viral, it can take weeks. For management, I'm going to focus on the common types of seasonal and perennial allergic conjunctivitis, but if you'd like me to do a video on management on the other types, let me know in the comment section. It's often self-limited, but in severe cases, further treatment may be needed. So it's important to avoid exposure to the allergen as soon as possible. And if the case is mild, sometimes frequent cold compresses and lubricating drops, so the over-the-counter, preservative-free, artificial tear eye drops, may be all that's needed. The lubricating drops can provide symptom relief and may help to wash away the allergens. Depending on the severity and symptoms, patients can also use a topical anti-allergy eye drop as needed, like an antihistamine. This provides a fast onset of symptom relief, generally in minutes, and it can be used to address the current problem. Think of it like firefighters on call that help with the immediate problem. A mast cell stabilizer is another option, but the downside is that it can take longer to take effect. It can take days. So it prevents mast cells from releasing more histamine. So it basically tries to prevent a future problem. Think of it like fire safety measures you install to try to prevent another fire, but it doesn't really help with the current fire. There's also combination eye drops that help to provide a short term and long term benefit, which is like a 1-2 punch. An over the counter option is olopatadine. In addition to a topical anti allergy eye drops, patients can also consider using an oral antihistamine as needed. It's important to counsel the patients to avoid eye rubbing as best as possible. Let's say a patient has a mild case of allergic conjunctivitis. They could use frequent cold compresses, over the counter, preservative free, artificial tear eye drops at least 4 to 6 times a day. They can increase as needed. And remember the tip, lubricating drops can go in the refrigerator to cool for comfort. And they could use olopatadine eye drop as needed. But if it's a severe case, in addition to the frequent cold compresses and the lubricating drops, which they can use even more of, they could use the olopatadine eye drop scheduled following the instructions on the box, as well as adding an oral antihistamine. Depending on the severity and the patient case, could consider low-dose topical steroid prescribed by an eye doctor, but this is generally not first line and it's recommended to try other things first to see if it improves, especially since it's often self-limiting. But if the symptoms persist, then a referral to a dermatologist or allergist is recommended. Like in viral conjunctivitis, there can be complications in allergic conjunctivitis as listed on the screen, so it's important to have a patient follow up with an eye doctor. This gives a nice visual of the differences and similarities between viral and allergic conjunctivitis. If you'd like a downloadable copy, click the link in the description below. And if you want more content like this and to grow your knowledge about eyes, click subscribe, and I'll see you in the next video.